In Ecuador, citizens have denounced a lack of coordination and logistics in the vaccination plan implemented by President Guillermo Lasso's administration. Let's take a look at the details in the following report by our correspondent Denisse Herrera.
The 9 million in 100 days vaccination plan implemented by President Guillermo Lasso's administration is advancing amid citizens' discontent. To speed up the vaccination process, one of the government measures was to distribute the vaccine according to police stations. However, it has now been decided to merge vaccination sites.
Now, surprise, surprise, they tell us that we have to come here because they are setting up only one vaccination site. And my question to you, Mr. President, is, do we have to come here to get infected? And you have us senior citizens like this, what happens if it rains? Please, Mr. President, give us back the vaccination site in each neighborhood. I see this, and it is a shocking thing. In a little school, everything was already programmed, without people. But these small inconsistencies cause problems because we come desperate to get vaccinated, and this is when infections can spread.
Authorities say the merging of some vaccination sites was due to a lack of people showing up for the jabs.
According to the analysis we undertook, we noticed an absence of people, and in those sites we combined, we had an excess demand of people, so the transportation of the vaccines to the small centers was made difficult, and we are looking for a better way to take care of citizens, and that is why we decide to merge them in order to better assist citizens.
For their part, public health sector personnel emphasized that the situation in hospitals continues to be critical and that there is still 100% occupancy in the COVID zones.
What has decreased is the number of short-stay patients, which allow us to use certain areas, but there has been no fall in the number of COVID-19 patients that arrive. We must understand that of 200 patients that arrive, 140 are lower-risk patients, and the hospital is still at 100% of its COVID-19 capacity.
According to the government, as part of its plan to vaccinate 9 million people in the first 100 days of the new administration, over 1.2 million people have already been vaccinated, and more than 1.1 million have received at least the first dose. This makes for a total of over 3.5 million people across the country.
Denisse Herrera, teleSUR, Quito, Ecuador.